My name is Shari Lipner, and I'm an assistant professor of dermatology at Weill Cornell Medicine. My specialty is nail diseases. I see a lot of patients with onychomycosis, but another common problem I see is Pseudomonas nail infection, otherwise known as green nail syndrome. And this may be a standalone problem, or it may coexist with nail fungal infection. And while we can sometimes see these nail changes clinically, sometimes it's good to get a laboratory confirmation. Many of you are familiar with doing wound cultures, but there's now a new technique where we can amplify the DNA of Pseudomonas, otherwise known as PCR, and really get a result that way using a molecular test. And this is now available. Pseudomonas nail infection is a very frustrating condition for patients because it's often misdiagnosed, and having a molecular test to help with the diagnosis is very helpful, and these patients can get the treatment that they need. This is a common problem, and I see at least one case out of a half-a-day practice. So Pseudomonas loves wet environments. We often see these in patients that wash their hands excessively, so people that work within healthcare, as well as patients who wash dishes often. Maybe they're stay-at-home moms or dads who have a new baby at home and they're washing a lot of bottles. People that work in the food industry who often have sort of wet hands and wet nails, so that's the common population. So sometimes these patients have nail problems that either coexist with a fungal nail infection or a standalone problem. And while clinically sometimes it's easy to see this nail infection, sometimes you really need a laboratory confirmation so that we can help these patients treat the bacteria and have patients having better looking and more normal nails.